Public was started in September 2005 by the NHS Consultants Association, a small group of about 700 consultants out of 15,000 or whatever it is, consultants in the NHS, who believe thoroughly in the NHS and on the whole go through private practice. The NHS Support Federation, which was started in the early 90s after Kenneth Clarke's reforms, which called working with the patients, they started the spin right back then. And Professor Harry Keane is their president. He's a retired diabetic physician from Guy's and is, incidentally, the Miliband's uncle. And Health Emergency, which is run by John Lister, who has spent 25 years researching into the NHS and has written a couple of magnificent books about the NHS. Now, the aims of Keep Our NHS Public were to build a broad non-party political coalition to campaign to protect the NHS from further privatisation and fragmentation, because we were worried that in 2005 the NHS set up a directorate called the Commercial Directorate. Its first head was an American from United Health, with its terrible record of fraud in the States, and she went off to be the vice president of a Swiss bank after 4 years. We wanted to inform the media, the public and MPs about the government reforms, and we worked hard at this, but it is an uphill battle. To keep our NHS public, which means publicly provided as well as publicly funded. And all the parties have been saying the NHS will remain free at the point of use, blah, 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 but they have all said they don't see anything wrong with having other providers. Now, when this bill, this white paper came out, it should have been a green paper for a start, which would have given us a chance to really discuss it, but that wasn't so. A lot of the things, the media fastened upon the GP commissioning of the 80%. They left most of the other things, really, they didn't discuss them. And I think one of the most important things is the transfer of responsibility for the NHS from the Secretary of State for Health to a new NHS commissioning board. And when you look at the bill, which is 367 pages long, it's got 288 clauses, it's got another impact assessment which is about 80 pages long. It doesn't mention who is going to be on this board. It doesn't say these jobs will be advertised, interviewed for, transparent, completely silent on the regulation of this really important committee. So it's going to be the crank of all crankers. They've been very clever with their language, and abolishing strategic health authorities. I mean, most people in the population have no idea what a strategic health authority does. I mean, what is left after they've reorganised, there's been 30 reorganisations, 15 reorganisations in the last 30 years, and we used to have regional health authorities, then they became outposts of the NHS executive called, and the regional medical officers all had to sign things to say that they wouldn't speak out of turn, and now we've got strategic health authorities, whose job was to plan the services for the population, and also to keep an eye on what the primary care trusts were doing. Now, the primary care trusts, of course, are very unpopular because they had to carry out the policies of the Department of Health. And so if the Department of Health wanted to do a particular thing, they did it, and if people didn't like it, the people who got blamed were the PCPs. Also, many of them were not at all transparent. They didn't want the public to talk to them. They resented their presence, it seems. And so it's very easy to paint these people as unaccountable bureaucrats. That it's come out that the PCTs have 140 statutory functions, including child protection. And so when they say they're going to have GPs doing the commissioning and get rid of PCTs, who's going to do all the other things that the PCTs do? Completely silent on that too. They've said that there's going to be a health and wellbeing board in local authorities. And this, of course, is part of the Lib Dems' manifesto commitments of getting more localism. But what the Lib Dems had said was to have far more of the public on these boards. And it looks as though these health and wellbeing boards will only have one council member and the others will be officials of the council. So the idea of having ordinary citizens on these seems to have gone out of the window. Now, they then said they'd create these 300 to 500 groups of GPs called consortia, which would take on the commissioning, which is purchasing of services. And just before the second reading, Cameron was able to say that half of the country's population was covered by Pathfinder consortia which had been set up. Now, this is not that GPs are keen to do this, but they realised that if they didn't step into the breach, they would soon find that A, the extra money that was going into the consortia wouldn't come their way, and B, the private sector might get in there as well. This whole question about commissioning is, I think, a huge con. They set up this commercial directorate, set up something called world-class commissioning. And I went to listen to some of the evidence when the Health Select Committee were doing the inquiry into that last year and the year before. And they said, I mean, in evidence, they said, well, actually nobody's done this before. You know, there wasn't any real background to it. And they've got a whole huge sort of panoply of meetings where they get the PCT managers there to teach them how to do this world-class commissioning. And then they have a whole lot of competencies that they all have to check off, and then they say they're good at it. But Scotland and Wales have decided to get away from the market, and they are still running hospitals and providing services, and the NHS continues as it used to in Scotland and Wales, and they don't have any of this world-class commissioning nonsense. It's quite unclear whether there was any value in this at all. And as far as the consortia are concerned, when Cameron managed to say, no, this isn't a revolution, this is just evolution, we're just building on what New Labour did. Well, they are, of course, building on what New Labour did. But they are going much farther, and nowhere in their manifestos did it say they were going to get rid of PCTs and strategic health authorities, i.e. the entire administrative structure of the NHS. And they're basing this commissioning by GPs on the GP fund-holding experiment with Kenneth Clark as Secretary of State for Health, and very little work was done on that. And what work there was done suggests that overall it didn't improve things and it cost a lot of money. And then we've had a GP practice-based commissioning, and then they're saying, well, this is going to be. But most of those GPs who've been in the practice-based commissioning, not real budgets, but imaginary budgets, have been overspent their imaginary budgets. So how getting all the money to the GPs is going to make things work is hard to say. And they're going to replace the 152 PCTs. Now, we don't know how many of these consortia there are going to be, because Lansley says, well, it'll be up to the local people, and we can have consortia that are just 2 practices up to covering 1 million people. I mean, this is nonsense, absolute nonsense. But anyhow, unless it's less than 152, it's going to cost more because you've got all these different transaction costs going on. But what I think is even more disturbing is that we have been fighting a lot of this on the basis of the commissioning. And in the last week, we've heard that they're now talking about having recognised providers who would be licensed by the Care Quality Commission and monitor, and there would be a list, and when patients go to their GP, they will be offered this list and they choose a hospital to go to. Now, if that is the case, then what do we need GP consortia for anyway, if the patient's going to do this? And what's more, none of this wasn't discussed in the debate. At least I didn't listen to all 7.5 hours of it, but I listened to 4 hours of it, and there's been nothing in the papers about this. This is coming out of the Department of Health in a sort of secret way, and apparently on Twitter as well. Now, the other things there, we're forcing all hospitals to become foundation trusts. And that was Labour Party policy, but they didn't manage to get it to work, because you had to be sort of financially solvent, and we all saw what happened when we concentrated on that, and the Mid-Staffordshire example. But the new thing was for them to become employee-led social enterprises. Now, Labour did try that as well. I think they got one lot of nurses in Surrey who agreed to do it, and only because their arms were twisted, because most people don't want to be running this and doing the payroll and all the rest of it. They're very happy to have someone else do those things, but which we as health professionals are just not trained. They keep on talking about John Lewis's. Well, I like John Lewis. How many John Lewis's are there? And I heard Lansley say, oh, there are already 1,000 social enterprises in the NHS. Really? Where are they? And somebody said, oh, well, he's probably talking about little contracts that people had for small parts of the work. But do you know anybody who's a social enterprise doing work for the NHS? Because if so, I'd be delighted to hear about it. Now, the encouragement of any willing provider has been well explained. Dear old Lansley said that the PM gave him a whole week of time in the afternoon to give spouted propaganda. And on the 5th day, there were questions from the audience, and he was asked about the EU. He said, no, EU law won't apply. Now, I don't know if any of you have seen the Captain Scar video on YouTube. Liar, liar, liar. Anyone seen that? Well, if not, I'll send you the or you just put his Captain Scar, I think. But it's a wonderful little song with the chorus, liar, liar, liar. And then it interposes the various politicians saying their things, including Mrs. Thatcher. This gone. So I don't believe what Lansley said when he said it won't apply. Most of the experts in the field, because it is a complicated field, don't think that if you open it up to any willing provider and have competition encouraged by monitor, that they will be able to get away from it. And that will completely destroy the NHS as we know it and get us into the situation as in America, where despite their 35% administrative costs and the huge amount of their GDP that they spend on health, which is about 30% now, they still had, before Obama's bill, something like 50 million people who were uninsured and therefore couldn't get any health care. Now, reducing the NHS management cost by 45% over the next 4 years. Throughout all this debate and all the reams of newsprint that have come out, not once has the cost of the market, which was introduced by Kenneth Clarke, built upon by New Labour, has that come out. And at that Health Select Committee hearing, the committee asked the Department of Health officials, how much does it cost, all this transaction cost and tendering and the rest of it? And they were evasive. Now, I don't know if they're evasive because they don't actually know. What they referred to was a 2002 paper which compared management costs of about 9 different countries and if you look at Canada versus the States, you can see the cost of the market well reflected in that. But